Urinary tract infections, or UTIs, are incredibly common infections that affect millions of people each year. UTIs occur when bacteria, and in some cases, fungi or viruses, enter the urinary tract and cause an infection. The urinary tract is responsible for removing waste products from the body in the form of urine. It's made up of several important parts: the kidneys, ureters, bladder, and urethra. The kidneys are two bean-shaped organs that filter waste products from the blood and produce urine. Urine then travels down two thin tubes called ureters to the bladder, a hollow organ that stores urine. When it's time to urinate, the bladder empties through a tube called the urethra, which carries urine out of the body. UTIs can affect any part of this system, but they most commonly occur in the bladder and urethra. The vast majority of UTIs are caused by bacteria, specifically a type of bacteria called Escherichia coli, or E. coli, which normally lives in the intestines. In women, the urethra is much shorter than in men, and it's located closer to the anus, making it easier for bacteria from the digestive tract to enter the urinary tract and cause an infection. This is why UTIs are much more common in women than in men. While bacteria are the primary culprits behind UTIs, fungi and viruses can also be responsible in rare cases. Certain types of fungi, like Candida, can cause UTIs, especially in people with weakened immune systems or those who have been on antibiotics for a long time. Viruses, such as adenovirus, can also lead to UTIs, but this is less common than bacterial or fungal infections. While anyone can get a UTI, certain factors can increase your risk. As mentioned earlier, women are more prone to UTIs than men due to their anatomy. Sexual activity can also increase the risk of UTIs in women, as bacteria can be introduced into the urethra during intercourse. Other risk factors include age. UTIs are more common in older adults, especially women who have gone through menopause. Catheter use. People who use urinary catheters, which are tubes inserted into the bladder to drain urine, are at an increased risk of UTIs. Diabetes. High blood sugar levels can weaken the immune system and make it easier for bacteria to grow, increasing the risk of UTIs. Pregnancy. Hormonal changes during pregnancy can affect the urinary tract and make it easier to get a UTI. Kidney stones. These hard deposits in the urinary tract can block the flow of urine, increasing the risk of infection. Weakened immune system. People with weakened immune systems, such as those with HIV/AIDS or those undergoing chemotherapy, are more susceptible to UTIs. UTIs are classified based on the location of the infection. The most common types of UTIs include cystitis. This is an infection of the bladder, the most common type of UTI. Symptoms include frequent urination pain or burning sensation while urinating, cloudy or strong-smelling urine, blood in the urine, pelvic pressure or discomfort, urethritis. This is an infection of the urethra, the tube that carries urine out of the body. Symptoms are similar to cystitis and may also include discharge from the urethra, itching or burning in the urethra, pyelonephritis. This is a more serious type of UTI that affects the kidneys. Symptoms include fever and chills, back pain or flank pain, nausea and vomiting, confusion, especially in older adults.